Hello and welcome to this edition of CancerTV News. I'm your host, Belinda Pinello. In this broadcast, we'll focus on colon cancer. We'll look at a new report on how the racial gap for colon cancer deaths is widening, a less invasive surgical procedure for patients, and advice on effective preparation for colonoscopies. When it comes to colon cancer deaths, the gap between the races is growing. Experts partly blame blacks' lower screening rates and poor access to quality cancer care. The American Cancer Society reports that colon and rectal cancer death rates in the black community are nearly 50% higher than in whites. Since the 1970s, this gap has been growing. Then the rates were fairly balanced. In the 1980s, colon cancer began to kill blacks at a higher rate. Researchers aren't sure why. In general, the rate of new cancers is coming down and death rates in the U.S. continue to fall. However, for colon cancer, the decline for whites has not been seen for blacks. The American Cancer Society reports that 2005 was the most recent year for which statistics are available. The rate of diagnosis for blacks was about 19% higher than whites. The difference in fatalities was even more prominent. For every 100,000 people among blacks, there were about 25 deaths compared to 17 for whites, a 48% difference. The screening for whites is 50% compared to just 40% for blacks. For Hispanic, it's only 32%. Although for Hispanics, there are fewer overall deaths, less than 13 per 100,000. Colorectal cancer is the third leading cancer killer in the United States. Colon cancer deaths can be prevented by early diagnosis through screening and quality care. In other news, less invasive surgery for colon cancer may be an acceptable alternative to open surgery. Laparoscopic surgery is a technique in which an abdominal operation is performed through small incisions rather than larger traditional incisions. Benefits include less scarring, less pain, and shorter stays in the hospital. Researchers in Halifax, Canada, studied colon cancer patients from 29 European hospitals. They found that the difference in survival without disease between those who had laparoscopy and open surgery was small. Further studies are needed to determine whether open or laparoscopic surgery results in better patient outcomes. Finally, experts say colonoscopies are still among the best ways to detect cancer and save lives from colorectal cancer. A colonoscopy involves viewing of the inside of the colon through a long, flexible tube inserted in the rectum. It is the preferred screening method for colon cancer and can help to prevent about 2/3 of deaths due to this cancer. Past research has shown colonoscopies can find many round polyps but often miss flat or indented lesions. This Canadian study shows the tests remain lopsided. Although colonoscopies reduce deaths from cancers found on the left side of the colon by 67%, they did not reduce the risk of death from cancers on the right side of the colon. The findings suggest that the benefits of colonoscopy in preventing deaths from colorectal cancer are largely limited to abnormalities that occur on the left side of the colon. Recently, the Food and Drug Administration issued a black box warning about 2 of the pills used to cleanse the bowels before a colonoscopy due to fear of kidney damage. However, the American Cancer Society still recommends colorectal screenings and liquid bowel preparations. The ACS recommends that patients find a doctor who has performed at least 200 procedures and should also consider taking their bowel prep in 2 doses. Clear colons provide doctors with the best views of tissue. Well, that ends this episode of CancerTV News. Thank you for joining us, and please visit us next time.